Glanders is a fatal infectious disease of equines caused by gram-negative bacterium, now known as Burkholderia malae. The natural hosts of Burkholderia malae are horses, donkeys, and mules. Other than equines, glanders can be naturally contracted by small ruminants. Carnivores can be infected through the ingestion of contaminated meat. The disease has been recognized almost since man began recording equine disease as a result of economic and zoonotic impact of glanders. It is listed as notifiable disease by OIE. Glanders has a zoonotic potential and humans may get infection through direct and prolonged contact with infected animals. Alleged use of Burkholderia malae as a bioweapon was recorded in World War I and II. Glanders has been eradicated from large areas of Western world in the early 20th century. Today, the disease is restricted mainly to Middle East, Southern Asia, South America, and Northern Africa. Disease may appear as an acute or chronic illness. Acute glanders is more common in donkeys. Chronic glanders is more frequently seen in horses. Chronic illness may appear in one of three forms, namely nasal, pulmonary, and cutaneous or farcy. Cutaneous form of glanders or farcy exhibits ulcerous nodules around muzzle and extremities, especially hind limbs. Nodules and ulceration may be seen anywhere on the body. Nasal glanders is characterized by nasal discharge, commonly associated with hemorrhage exudates. Formation of nodules in the nasal septum. Many of these nodules rupture and liberate infectious yellowish-green mucopurulent exudates. Pulmonary form is considered as an extension of nasal form to the lower respiratory tract. A pulmonary infection typically produces pneumonia, pulmonary abscess with associated signs and symptoms. Visceral abscess is common, and the spleen and the liver are frequently involved. The primary route of transmission among equines is the ingestion of contaminated feed and water and sharing of contaminated fomites. The incubation period of glanders in equids varies from a few days to many months, most frequently between 2 and 6 weeks. After infection, the organism generally travels through lymphatic channels and regional lymphangitis develops within 7 to 10 days. Multiple ulcerative nodules are distributed along the lymphatic vessels of the hind limbs and the abdomen. Erupted nodules exude gelatinous pus. Visceral abscess, especially in spleen and liver, are frequently observed in disseminated infection. With ocular involvement, excessive lacrimation and photophobia are common. Testes are enlarged, swollen and develop orchitis. There are a number of virulence factors produced by B. malae that are important in the pathogenesis of the disease. Some of these virulence factors include secretion systems, autotransporter, quorum sensing, type 4 pillin, etc. The availability of high-quality biological specimens is of utmost importance for laboratory diagnosis. Because the glanders is a zoonotic disease, biosafety guidelines must be followed during sample collection from suspected equines. For detection of Burkholderia malae antibodies in equine serum, aseptic collections of blood and quality serum separation are vital steps for accurate outcome of serological diagnosis. For bacteriological examination, important clinical samples include nasal swab and swab from fresh cutaneous lesion. Specimens should be kept in tightly sealed, leak-proof containers and transported in sealable, leak-proof plastic bags. Observation of typical clinical signs like nodules, nasal discharges, ulcers and a debilitated condition could be sufficient to make a tentative diagnosis of glanders. The clinical signs of glanders in equines must be differentiated from strangles, ulcerative lymphangitis, pseudotuberculosis, and epizootic lymphangitis. However, laboratory diagnosis is essential to identify latent and clinically inapparent animals in an outbreak. The definitive test for Glanders diagnosis is the isolation and culture of the Burkholderia male from the fresh cutaneous lesions. There is a confluent, slightly cream-colored growth on glycerol blood agar. With continued incubation, the growth thickens and becomes dark brown and tough. Handling of suspected biological samples and culture isolation must be done in Biosafety Laboratory 3. A number of polymerase chain reactions and real-time PCRs have been developed to improve the detection of Burkholderia male, but only a PCR and a real-time PCR assay targeting FLIP gene were evaluated using clinical samples. Several molecular typing techniques like PCR, RF-LP, pulse field gel electrophoresis, multi-locus sequence typing, and variable number of tandem repeats can be used for further discrimination of isolates. There are multiple serological tests available for the diagnosis of Glanders. Among these, complement fixation test (CFT) is so far the only officially recognized serological test for international trade of equines. The CFT is reported to be 90 to 95% sensitive, with the ability to detect positive sera as early as 1 week after infection. A sample that produces 100% hemolysis is negative, 25 to 75% hemolysis is suspicious, and no hemolysis, 100% fixation is positive. Questionable sensitivity and specificity with donkey and mule serum is one of the major limitations of the test. Indirect ELISA using recombinant proteins offers safer, rapid and efficient means of serodiagnosis of Glanders in equines. ICAR NRCE Hisar has developed 3 recombinant proteins-based ELISAs which showed high diagnostic specificity and sensitivity and can be used as a screening test. Immunoblot assay with partially purified lipopolysaccharide contain antigen of 3B Malay strains was developed at OIE Reference Laboratory on Glanders, Germany. Immunoblot showed a higher diagnostic specificity as compared to the prescribed CFT. Further validation of the ELISA and Immunoblot assay in according to OIE protocol is in progress at OIE Reference Laboratory, Germany. Treatment for Glanders is forbidden in many countries and no vaccine for prevention of the disease has been developed. Prevailing control policy according to laws and legislation are identification and elimination of infected animals. Persistence of Glanders in developing countries poses a serious concern and warrants more intense and adequately funded control programs. There is clearly a need for a highly specific and sensitive test or for a series of tests for the accurate detection of Burkholderia male. Simple and effective compensation policies should be evolved along with organization of an awareness campaign to educate equine owners for control of Glanders.